This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
We believe that service lines are a true growth engine for organizations because of the complexity of service lines and because of the opportunity that exists for most organizations to continue to broaden and deepen those service lines. As you're thinking about growth and where to make investments in the future that are going to have a significant return, don't forget about your clinical programs, your service lines, your centers of excellence that you have within your organization, and peeling back the onion to see if there are opportunities to further invest and enable growth within those areas.
Hello and welcome to Sg2 Perspectives. I'm your host, Tori Richie. Today, we have two experts from the Vizient Sg2 Strategy Consulting team. I'm joined by Melissa Threlkeld and Ryan Hallenbeck. Thank you for joining.
Thank you, Tori.
Thank you for having us.
What we're going to talk about today is service line strategic planning. Before we dive into some of the details here, I'm curious, what are you hearing today as it relates to service lines and key topics in this area?
It's been really interesting. We have been seeing this reemergence of interest in service lines. Like a lot of things, there tend to be trends that are cyclical. And we like to joke with our clients and say, service line planning, service line infrastructure, service line development is a lot like bell-bottom pants. Bell-bottom pants were popular in the 70s. Then we went away from them, and they seem to be reemerging. We would say the same for service lines. Those of us who were in graduate school 20 plus years ago did a lot of study of service lines and the importance and structure of service lines. That was the topic du jour back then. And then we've gotten away from it. And now we seem to be cycling back. We have had a lot of clients and members reach out to Ryan and myself and other members of our team to start to think about how do they rethink service lines. Traditionally, service line leadership has been about clinical infrastructure, clinical protocols, clinical focus. And what service lines are doing today are really starting to morph into more strategic and growth focus. There's just been this rethinking about how do you lead service lines? How do you govern service lines? How do you set up service lines to really fuel the growth engine of an organization in addition to that historic focus on more of the clinical engine?
I think that's well said. The only thing I would add to that is the activity that we've seen over the last few years. One, you had post-pandemic performance, which has really had financial implications overall for health systems. And there was a thought generally that we can cut our way, whether that be programs or expenses or other areas within the health system. And what I think health systems are realizing now is they actually have to figure out a way to grow through the macro environment. And we believe one of the best ways to grow in this environment is through service line performance. It has been cyclical. It has started to come up. And I think the other thing that we're seeing is you get a lot more of the merger acquisition activity that's taking place overall within the sector, whether that be locally, regionally, or nationally. And health systems are trying to figure out how do they bring in these disparate assets into their portfolio overall and have a maximizing effort and ability to do things at scale. Service lines give us the capability to doing so. And then finally, we've also heard a lot about smart growth. It's a term that gets used frequently. Service lines give us an opportunity to really focus in on that smart growth and target segments of the patient population or that patient mix that we think are most important that will then ultimately drive additional financial performance for our members.
That's right, Ryan. And you talked a little bit about this when you said mergers and acquisitions, but I think there's been a renewed focus on what we're calling systemness, but really starting to approach service lines less from a hospital by hospital perspective and more from a how do we leverage the best practices and the services that we have, the clinical programs that we have, the centers of excellence that we have across our health system, and really build a coordinated system-wide strategy. Historically, each hospital has been incentivized to build their programs solo versus being a part of a macro environment or a broader health system. And what we're seeing as a part of this reemergence of service lines is health systems wanting to take an approach that says, let's elevate service lines to the system level or to a market or region level and have one coordinated strategy that then leverages the opportunity to accelerate growth in a way they haven't done before. A lot of organizations are starting to say, how do we distribute services strategically? How do we rationalize services strategically? And how do we capitalize on significant growth opportunities through the engine of service lines?
That was going to be my follow-up question there, Melissa. As you're teeing up this reemergence of service line discussions, I was curious what the evolution has looked like here, because I have to imagine that in today's environment, there is a bit more focus on that systemness lens, but also how do we better integrate services? How do we improve access to patients, particularly specific patient populations? Could you talk a bit about some of the key components that are part of these strategic planning projects and what holistically organizations are thinking about to make sure they're going to market with a robust, but also perhaps differentiated service line offering than what their competitors have?
Yeah. Number one, as we think about service lines and the reemergence of service lines, you have to start with looking at leadership and infrastructure. You start there in order to be successful. It has to be a first stepping stone in the build of a system-wide service line. And what's different is historically, most organizations had service line leaders that were focused clinically and operationally and in the depth of the service line within the four walls of the hospital. What we're finding now as this topic reemerges and people redefine what service lines mean and restructure what service lines look like, we're seeing an elevation of the service line leadership role at more of a system level. And it's more encompassing. It's less about operations and somewhat still about clinical, but most organizations would say they've done really well clinically managing service lines. And some are even shifting the clinical focus into the quality infrastructure of their organizations and saying service line leaders need to be strategically focused. And the key components of that are how to drive growth, how to select which sites have which services. So said another way, hub and spoke approach. Maybe we don't have the same breadth and depth of services in each of our hospitals. And also how and where to focus on site of care outside of the four walls of the hospital. We at Sg2 and Vizient do a lot of work on forecasting growth. And a lot of forecasted growth within service lines is in the outpatient environment. Hospital systems have started to say, what assets do we need to have outside of the four walls of the hospital to complete the continuum of care by service line? Ryan, additional thoughts there?
You said it really well that it does start and end with leadership. What we've seen organizations recognize as well is not only getting the right leaders at the table to help form strategy, it is about who are those clinical leaders from a physician standpoint to include in your strategic planning process. But the other thing that you mentioned is also the alignment of those leaders and ensuring that we've got the right incentive structure in place, especially when we're talking about health systems that have multiple hospitals, maybe stretch across a wider geographical region. And what you're trying to create, which is not easy to do, and it takes time and intentional effort, but what you're trying to create is a situation in which you're not competing with each other, but you're actually competing as the whole system, and you're complementary as to where those services are provided for what's best for the patient, maybe not what's best for that individual hospital. If we're doing what's best for the patient, it really helps drive the volume and the loyalty that we are ultimately seeking. The other thing that I think is another key driver there overall, and I spoke to it a little bit, is around the physician and your physician portfolio, recognizing that in this day and age, most physicians are employed. There's some that are in private practice. There's some that are part of private equity. Most are employed through a health system. And we also recognize for our CFO friends out there that there's a pretty significant financial burden by employing physicians. And so how do we maximize our investment in our physicians, in our providers, our mid-level providers, and really in ensuring that they are involved, that they're helped drive strategy, not only in the ideation of it, but then also in the execution. And then finally, we're seeing across our SG2 membership that well over 60% of members have a dyad model in place, but they're looking at, is it the most effective? Do we have the right individuals in the role? Do we have the roles and responsibilities for these individuals correctly identified? And then are we setting them up for success to then help drive strategy home? That physician portfolio and provider portfolio is absolutely critical. And what we oftentimes tell our members is either you use it really well and leverage it to its full extent, or you have the opportunity to lose it. It's easy at this point in time for physicians and other members of your executive team to switch that jersey. And when that happens, there's a significant loss. And obviously there's financial ramifications and just programmatic ramifications overall.
I like that, Ryan. And you talked about using or losing the physician enterprise. One area that's really important in how to utilize physicians as a part of a dyad. So an administrative and physician leader leading a service line and having responsibility for strategy. Another way that we work with our clients is in recommending governance structures. And we like to say that physicians are really important to help guide and inform strategy and can actually be thought of as strategic advisors to the dyad, bringing them in and allowing them to sit at the table with the dyad to say, how do we differentiate services for the service line within our organization as we look to compete with competitors across the market, whether the market's a local market, a regional market, or a national market? Where do we have expertise and programmatic offerings that are differentiated that allow us to have competitive advantage? Where do we have gaps in service that if we want to compete and grow and attain a higher market leadership status, we would need to close those gaps in care? That's another way that we recommend we pull physicians in. In general, one thing that's really interesting is whenever we get calls, we get a lot of calls for how do we continue to grow revenue? It's such a big focus of organizations right now. I think there's been a lot of effort in cost cutting, but with all the workforce shortages, now it's almost like there's a need for revenue to continue to accelerate. And so we get a lot of just questions of where do I need to focus growth? And we always start with service lines because it seems like an area, one, where there's often lots of growth opportunity from a volume and revenue standpoint, but it's also an area that to execute on a strategy and service lines well, you have to have a lot of rigor and a lot of strength and execution. And that's something that we feel like builds muscle memory for an organization. So if you can take a really strong growth strategy and execute that in, say, cardiovascular services or cancer services, two of the areas where we probably have the most interest from our clients and our members right now, if you can do that really well, then those skills are transferable to other strategies within the organization because you've built some rigor around execution that creates a muscle memory that then you can tap into as you go and build other growth strategies across the organization. Would you agree?
I totally agree. And I think you brought up a really good point earlier when you said, as you're going through your planning process, there's at times you identify gaps, whether that gap may be something that you don't provide today. And really, as we think about hallmark of SG2, the system of care, what we're recognizing with health systems today, as you look around along that system of care, we'll take cancer as the example, really starting at screening, but then getting screening into the primary care offices, into the specialty practices, into the acute, and then into the post-acute setting. What systems are recognizing that there may be gaps along that system of care, and either it's their opportunity to close that gap, or can they look at partnership opportunities to help close some of those gaps? And sometimes it's across the full system of care that they want a gap closed, or there's segments of it, recognizing that at times they're not able to own the whole thing because it's cost prohibitive to do so. One example that we recently completed with a large academic medical center was just looking to expand beyond their current offering. And was there partnership opportunities kind of throughout the United States that allowed them to extend what they did really well outside the four walls of their existing state? That assessment allowed them to identify markets that were attractive, that brought together the collection where there was an opportunity around the collection of patients and volumes and financials, but then also where they could leverage their model to really improve care overall. And they started with that quality of care on the forefront, but that partnership piece is becoming even more strategically significant because systems are recognizing it's not always best to do it ourselves. Maybe there's another expert in the field that we can partner with to help drive that home, which also overnight allows you to have some recognition and community perception that improves because there's a national brand that's now offering assistance, even we recognize that care continues to be provided locally. So partnerships is a key aspect of that overall. And then there's also the idea of when we're thinking about a service line, yes, we want to have that collection of expertise there and available for patients when they need it, but also thinking about things further up the funnel. We use the example all the time of systems that have gone out and hired a fantastic surgeon or a fantastic specialist, but have missed out on who's going to actually look at feeding patients or feeding into the program overall. And they miss that upstream piece and they're surprised the results aren't what they anticipated from a performance financial perspective. So when we look at that system of care, really want to make sure that we're taking that further upstream and evaluating the whole thing, which does have an impact to service line performance.
And you've hit on some of my favorite topics to work with clients and members on, Ryan. Partnerships, expanding outside of your own market, and how do you think about expansion outside of your own market? My personal favorite topic is the upstream funnels, because a lot of organizations focus on the subspecialized expert and think that that differentiates them, but they don't spend enough time ensuring that there's an upstream funnel built to feed those folks and allow them to be successful. What this ultimately leads to is really there's no one-size-fits-all approach. And that's what I love about consulting and working with our members. You can have some constructs and some frameworks that you bring to the table, but really, in order to understand what's going to work best for your health system, you have to understand your health system. And that's what makes the most challenging and the most fun part of looking at growth is there is really no one-size-fits-all approach.
To that end, have you had the opportunity to develop frameworks to solve some of these very complex questions for members?
We have several frameworks that we have developed. We have a framework called the Elements of a High Performing Service Line, and we have that by service line, and we use that quite often with our clients and our members. We also have a general framework on programmatic maturity to understand the breadth and depth of your service line and to understand it across your system as well as individual facilities. We have an overall framework that we use for service line planning that has 5 elements that really starts with assessing the market, assessing the future growth opportunities within a service line, looking at what you have that's differentiated from your competitors, what the opportunity is to develop a new strategic vision, strategic plan, and then a tactical roadmap. We have a whole framework that outlines that work that we use with our clients and our members. And then we have a framework around service distribution or site of care distribution as you decide what assets you want to have, what programs you want to have within what assets across your health system and how broad and deep. And we have an 8-scale framework that we use there. So we at Sg2 Vizient love frameworks, and we love to take those and utilize those from a base perspective and then customize those for each of our clients and members.
A couple of important aspects to that. One, the beauty of these frameworks is they work well in whether you're a 20-bed hospital sitting in a rural location somewhere in the United States that's looking to get more involved from a service line perspective or evaluate a partnership with another health system, or to the largest of the large academic medical centers or very subspecialized programs. They can take these approaches and really drive strategic thinking to ultimately drive strategic execution. And then finally, what we've done with the frameworks and what we have seen this start to really amplify is the ability to then take the roadmap or the plan for execution, apply accountability to that, and then what are the visual management systems? How are the teams going to be held accountable to ensure that the plan is being followed? And then finally, giving the final framework around what's our annual planning process going to look like? And even those that may already have that in place today allows them to revamp to ensure that strategies stay fresh, they stay relevant, and it's an iterative living document, not something that is completed in a certain session, put on the shelf, collects dust, and then in 3 years is revisited again. Those frameworks have been relevant not only for different size systems, but then also really across service lines. It could be an orthopedic plan, it could be a cancer, cardiovascular, women's and children's. These frameworks apply to all of those and have been really well received. And lastly, what we've heard directly back from our members and our clients is our ability to take very complex information and plans and distill them down in a more simplistic way that is then even more actionable. So taking complex information, complex data analysis, and then putting that in a framework and a synthesized way that everybody can understand and then look to execute against.
And the great thing about that is that we have a lot of our plans then get presented at the board level. We can take something that's very complex, that has a lot of data and detailed analyses to support the work that we're doing, reframe it for the board level, which doesn't need necessarily the complexity of the data and the detailed analyses, but rather tells a story around the reason why the strategy is important, what the strategy is, what we're going to attain by executing on the strategy, how we're going to execute on it, and then how we're going to build in those measures to allow us to course correct, accelerate, amplify the strategies as needed. We believe that service lines are a true growth engine for organizations because of the complexity of service lines and because of the opportunity that exists for most organizations to continue to broaden and deepen those service lines. As you're thinking about growth and where to make investments in the future that are going to have a significant return, don't forget about your clinical programs, your service lines, your centers of excellence that you have within your organization, and peeling back the onion to see if there are opportunities to further invest and enable growth within those areas.
I did have a CEO recently just explain to me. So healthcare in 2024 is fraught with challenges. Organizations need to do something today different than what they did tomorrow to ensure that they have sustainability in the communities where they provide care. But what she then positioned that is going from a burning platform to a burning ambition. And that burning ambition is now where we see that service line planning start to play a major role overall. And then finally, the health systems that do this really well with the service line planning space, they keep the patient at the center of their planning process. And they're always referencing back to let's do what's best for the patient. If we do what's best for the patient, the quality tends to be better. The outcomes tend to improve overall. And with good quality and good outcomes, the financial performance tends to follow. So that patient-centric view has really allowed some of our members and some of our clients to really accelerate their strategic planning process.
He just mic dropped, basically.
Melissa, Ryan, those are great points to close us out here. It's always just so interesting to hear from the consulting side of the business to understand what are some of those complex problems that members are bringing to the table, and love taking a closer look at how it is that you're going about answering some of those questions. Thank you so much for spending time with us today.
Thank you, Tori.
Thank you for having us.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.